COVID-19.
Courtney has Matthew Myers, president of the Campaign for Tobacco-Free Kids, joining us live via Zoom right now to talk about this important subject.
Yes. Good morning, guys. Matthew, thank you so much for joining us this morning. So let's talk about the fact that, again, communities of color are disproportionately more affected by the effects of the coronavirus. But you're saying that also smoking is a huge additional issue on top of that.
Yeah, the coronavirus has really exposed two critical factors in our society. The first is that the tobacco industry's targeting of the Hispanic and African American community with their advertisements has a devastating impact on the long-term health of that population, and it shows up even more as a result of the coronavirus. What we're seeing is that African Americans and Hispanic are dying far higher rates than others. What we're also seeing is that smoking has been documented as an independent risk factor for increased risk of the most severe consequences in many of the underlying diseases. So we really have a terrible 1-2 punch. Coronavirus has exposed the fact that many of our communities are not receiving the same level of health care in our society, and the tobacco industry's targeting of the African American community and the Hispanic community, particularly with heavily flavored products, is having a devastating impact.
And this is not just limited to cigarettes. You're saying this is also vaping, other devices?
We have very solid data that smoking is an independent risk factor for the most severe risk factors of risk of coronavirus. But we also know that vaping causes the same kind of harm to the lungs. And in the United States, we're seeing a disproportionate number of younger people who are being hospitalized by these diseases. Over the last 4 years, we have seen the greatest growth in nicotine addiction as a result of flavored e-cigarettes among our young population. We don't have good data yet to show that there is a direct cause and effect, but we know enough about the harm of e-cigarettes on lungs to know that we should take action.
Okay. Matthew, we have run out of time, unfortunately, but there is plenty of information on your website. It's smokefree.gov. There's also a toll-free number, 800-QUIT-NOW. Thank you so much for your time this morning and shedding some more light on the situation. We appreciate you.
Thanks for having us.
All right.